Hello, my name is Kirsten FitzGerald. I'm a consultant paediatric dentist at Our Lady's Children's Hospital in Crumlin and at the Dublin Dental University Hospital. I specialise in looking after children who have special healthcare needs. In the last presentation, we looked at healthy mouths for regular children. In this presentation, we're going to look at healthy mouths for children with special healthcare needs. We all know that looking after teeth for children with special healthcare needs is really hard. There are so many competing interests. We all have worries about feeding, nutrition, speech, communication. But let's not forget about the teeth. The first tricky situation we all encounter is brushing. There are lots of helpful solutions. Helpful holding of the child is really important. Getting a good position and some stability is really useful. Lying down on a bed, using a mouth prop, maybe some lip and cheek retractors, and an extra adult to help can be really good. We use 3-sided toothbrushes a lot of the time. This helps to reduce the work. Some children like electric toothbrushes. Others might find it easier if you have a modified handle. Some suction toothbrushes are useful for children who are at risk of aspiration. If your children like timers, why not use one? And why not make this a time to play and have fun? Along with toothbrushing comes toothpaste. Lots of children don't like the flavour of those spicy minty toothpastes. There are strawberry ice cream flavoured toothpastes, there are bubblegum flavoured toothpastes, and for those who can't stand flavour at all, you can buy unflavoured toothpaste. The most important thing is to check for the fluoride content. Look for the number 1450 ppm on the back of the packet. You might like to try a detergent-free toothpaste that has reduced foam. Your dentist might recommend a prescription toothpaste. This will usually contain a high level of fluoride. Eating and drinking is another tricky situation for children with special healthcare needs. Lots of these children are on high-calorie diets with significant hydration concerns. We need to think about the frequency of eating and try to consider water as nature's favourite drink. For slow eaters and those with reduced clearance, try to avoid having food in the mouth all day long. For picky and limited eaters, try to reduce the accessibility of their favourite foods all the time and encourage new tastes. For children who are tube-fed and can't take anything by mouth, their saliva is really different. They can be orally defensive as well, and it's important to try to stimulate the mouth. These same children are often at risk for aspiration. Did you know that chest health and dental health is related? We have some more on this at the websites at the end of this presentation. Visiting the dentist sure is a tricky situation for children with special healthcare needs. My best advice is to go early and go often. Prepare yourself. Write some questions and answers. Use a diary. Prepare your child. And prepare the dental team if you can. Consider the unusual sights, sounds and smells at the dentist. You might like to think about a pre-visit visit where not too much is going to happen except just checking out the scene. Think about what appointment time is best. Try to make the first visit a simple one. It's not great to start with a tricky treatment. If it helps, bring a toy, a DVD, some favourite music, a blanket, and your child's toothbrush. If you think it's going to be useful, discuss helpful holding in advance. And please don't discuss your own bad experiences. You can see from the pictures here that we look at children's teeth in lots of different ways, and perhaps lying down on your knee might be better than lying on the dental chair. Sometimes dentists use a pillowcase to hold children's arms comfortably still if they're going to move them around a lot and be a danger. Visiting hospital to have dental treatment can be a real worry for a lot of children. The team at Our Lady's Children's Hospital have put together a really nice video on attending the surgical day unit, and you can find it by using the link. Sometimes things go wrong, and you really need help from the dentist. The best situation we can hope for is to have a good dental home. This really is an ongoing relationship between the dentist and the patient. It includes all aspects of oral health care, and it should be delivered in a comprehensive, continuously accessible, coordinated and family-centred way. It includes referral to dental specialists when appropriate, and it's a little bit like going to your GP. What kind of dentist does your child need? Only you are the expert in your child's needs. You're going to be able to choose the dentist best for them. For some children, a general family dentist is fine. For others, the community general dentist is very useful. And for some, only a specialist paediatric dentist will do. These can sometimes be found in the HSE, in hospital settings, or in a private practice. For adults, again, a general family dentist is very helpful. For some, the community general dentists are useful too. And occasionally we need specialist special care dentists. All of these will liaise with other subspecialties of dentistry when needed. Here are some helpful resources. Some of these give information for parents and patients, and others are useful websites where you can buy helpful supplies for brushing teeth and taking care of mouths at home. I hope you enjoy them. I'd like to acknowledge the help of my colleague Alison Dougal, who's a consultant in special care dentistry